right, welcome back to this Clean Out the Fridge Friday on Focal Point AFR Talk, the home of muscular Christianity on Conservative Talk Radio. And I just want to remind you the numbers that I gave you in the last segment. If we freeze spending, we balance the budget by 2016. If we allow the federal government to grow, spending to increase 2.3% a year, we balance the budget by 2019. Those are not my numbers. They come from the CBO and calculations done by Daniel J. Mitchell, who is an absolutely outstanding economist. So that is stuff that you can take to the bank, so to speak. Now, I want to talk about healthcare just for a second. Rob, if we can grab clip number 7, and then we'll probably play clip number 8 right behind that. You know, one of the real problems with Obamacare is that it's predicated on getting young people to sign up, called invincibles, people that are young, they don't need health insurance, they don't want health insurance because their health care needs are very low. They're young, they're healthy, they're active, they've got limited budgets because they're just starting out in their work careers, so they are inclined not to buy insurance. So President Obama says, we're going to make you do it. I mean, if Obamacare is supposed to be so good think about that just for a second. If this is supposed to be the greatest thing since mayonnaise, why does President Obama have to order people to do it at the point of a gun if it's so good for people? I mean, just the fact you got to mandate it all tells you that they know that this is contrary to what the American people want. If they were giving the American people what the American people wanted, they would not have to mandate it. Nobody orders people to go out and buy iPhones. Nobody orders people to go out and buy iPads. Why? Because people want it, so they go get it. So the mandate tells you right away that this is tyranny. If it's a mandate, this tells you right away this is a tyrannical imposition of central government power. But it's all predicated on young people signing up, and they are not doing it. They are not signing up in droves. Now, here is Representative Jim Moran, clip 7. Jim Moran is retiring. He's a Democrat, been in there forever. And these Democrats that retire now, that have said they're not going to run again, it's amazing how honest they suddenly get about Obamacare. All of a sudden, they're telling the truth about Obamacare. And here is a Democrat. This guy voted for Obamacare. He was a cheerleader for Obamacare. He was on the team that pushed this thing through. Now, listen to what he's saying now that he doesn't have to run for re-election on Obamacare.
I'm afraid that the millennials, if you will, are less likely to sign up. I think they feel more independent. I think they feel even a little more invulnerable than prior generations. But I don't think we're going to get enough young people signing up to make this bill work as it was intended to financially.
So he says it's not going to work. I mean, that's a Democrat saying we're not going to get enough millennials, enough young people to sign up to make this thing work. Now, I read a piece this morning. I didn't print it out, so I don't have it in front of me. But it was a piece that was, I think, on the Washington Examiner, and it was analyzing the rate of signups and how President Obama and the administration is wildly inflating the signups. They've said 6 million people have signed up for Obamacare under Medicaid. It's not true. It's maybe 1 to 1.5 million have signed up for Medicaid, and 3 million people have signed up for private insurance. But we know that those people are enrolled, but they haven't paid, that those numbers perhaps, and that of those people that are signing up and are getting private insurance, remember, we've seen surveys from the industry that indicate only 11 to 25% of those people didn't have insurance before. So 3/4 to 90% of those people are not getting insurance for the first time. That's among the 3 million people. So of those people, maybe you got 750,000 at the top end that are actually getting insurance for the first time and reducing this problem of the uninsured. Remember, the CBO said, look, we get this thing completely rolled out by 2024. There are still going to be 31 million people that are uninsured. So you're cutting into the uninsured problem by simply a fraction, and we're spending trillions of dollars to do it and completely complicating the life of the American people. Now, Duke University's out with a study today. 44% of U.S. firms are considering cutting health care to current workers. According to a devastating CBO report, a Duke University survey of top companies found that are adding to a devastating CBO report. A Duke University now, this is not part of the vast right-wing conspiracy. They did a survey of top companies. They found that 44% of them are considering reducing health benefits to current employees, taking health benefits away, reducing health care benefits, reducing health care coverage due to Obamacare. The problem is President Obama and Obamacare. Duke found that nearly half of these top companies, these are the best companies in America, the biggest companies in America, the companies in America that hire and employ the most people, almost half of them are reluctant to hire full-time employees because of the Affordable Care Act. Why? Because obviously you got a full-time employee. You are ordered, you are required, you are obligated to provide health insurance for them, and it'll break the bank. Remember the AOL guy yesterday saying, look, Obamacare is adding $7.1 million to our costs every year. $7.1 million. We got to find that somewhere. That's either going to be increased costs to consumers, it's going to be reduced benefits to employees in other areas, or reduced wages. There is no other way to do it, and fewer hires. So it's a killer for the economy. Now, this Duke University survey says 40% are considering shifting to part-time workers to get under that 30-hour per week threshold, so they're not obligated to provide insurance and aren't subject to the huge fines. And they're looking at hiring fewer workers or firing some because of the onerous burdens of Obamacare. The study says, quote, 1 in 5 firms indicates that they are likely to hire fewer employees, and another 1 in 10 may lay off current employees in response to the law. So this is a direct consequence of Obamacare. People are getting fired. People are not getting hired. People are having their hours reduced. People are having their benefits cut. So don't let Obama and the Obama administration lie to you. Obamacare is hurting the little guy, hurting the average guy. Now, President Obama is out there today saying, look, he's thinking about extending now the 3-year extension of the decree which allowed people to keep their health plans that were canceled because of Obamacare. Remember, Obama said, look, all these plans are getting canceled. So he came out with his edict, which he has no legal authority to do because the law is the law, passed by Congress. He signed it. He said the individual mandates got to go into effect January in 2014. So a lot of people are losing their insurance, and Obama said, okay, hey, I'll tell you what, we'll give you a 1-year reprieve. You can go ahead and keep your insurance. If you can talk your insurance company into giving you your old policy back, you can keep it. Now he's looking at extending that for 3 years. Why? Because this thing is killing people, because it's obviously not working. And so they're they're considering a 3-year extension, which would take us beyond the presidential election in 2016. It's all political with these people. They're looking at the calendar. When does the next election roll out? So we're going to let this thing float past 2016. Now, again, that would be another impeachable offense. He has no authority to rewrite the law on the fly like he's doing. And here's interesting. The way this is put in the Associated Press, the president's decision to let people keep their individual insurance policies. What is that? That is a pro-choice position. He's saying if the president allowed people to keep their individual insurance policies, if he let the people do what they wanted to do, then they would keep their old policies. They wouldn't go for Obamacare. So very clearly, even the AP is admitting this. When you deny people their freedom of choice, that's tyranny. That's the imposition of central government power. And the AP is saying that's exactly what's going on. And the president is thinking about giving people their liberty instead of coercing them into this program. And here's what the here's a quote from Avalere Health CEO Don Mendelsohn. The administration is entertaining a range of options to ensure that this individual market has stability to it. And that would be one thing that they could do. How do you get stability in the market? Freedom of choice. I mean, they're admitting it here. Obama's admitting we need some stability in the market. How do we do it? We get the government out of the way and we let people exercise their own freedom of choice. So they don't even realize what they're doing. AP doesn't realize what it's doing. A huge attaboy for the free enterprise system and for freedom of choice. Now, here's another, there are people that are going to fall through the floor under Obamacare that are right on the cusp. Remember, if you fall below the poverty line, if you make less than the poverty line, you're steered to Medicaid. That's $20,000 for a family of 3. If a family makes less than $20,000, they are steered to Medicaid. No premium cost. It's completely free to them. You and I are bearing the burden for providing their health insurance. But If they make over $20,000 a year, then they are obligated to purchase insurance, but they get a subsidy, a huge subsidy, to help them with that. So here's a piece, Daily Caller. What happens if someone is near the income boundary between the two programs? Now, we're talking about people at the bottom of the scale. What if this person overestimates income? Remember, you got to put that on your 1040 form. You got to estimate what your income is going to be for the next year so they can calculate your subsidies and calculate your penalties. So what happens if somebody at the bottom end of the scale overestimates their income? They think they qualify for a subsidized policy on the exchange, but it turns out they didn't make what they thought they'd make. Maybe they didn't get some work they usually got in the past, or their wages got cut, or they got laid off. So what's the IRS going to do to them? Is the IRS going to demand a refund of the subsidy? In other words, they got a subsidy. It turns out they weren't entitled to. Is the IRS going to go back and retrieve that subsidy from them? Not because they're too rich, but because they're too poor to qualify. I mean, this is the kind of absurdities you get into. The IRS, by law, would have to go after people to retrieve a subsidy, not because they were too rich, but because they were too poor. And that could be the difference of just $1. Now, here's a piece, talks about the sort of the upper end, that under Obamacare, it's possible if you earned $1 more a year in wages, you could wind up paying $20,000 more in insurance. So remember, you've got subsidies for health care up to a point. And then the more money you make, the more your subsidy is reduced. So here's an example, John McCormick, Weekly Standard. Take a 55-year-old couple living in St. Croix, Wisconsin. They make $62,040. Remember that's the precise number, $62,040. Again, it's a hypothetical, but this is how it works. If they made $62,040 in 2014 with Obamacare subsidies, they would pay $211 a month for the cheapest Obamacare plan available. Now imagine, for the sake of argument, that they earned $62,041. $1 more. They would wind up paying not $211 a month, but $1,342 a month. That's an extra $13,570 a year for making an additional $1 in income. That's how perverse this whole thing is. For a couple of 64-year-olds who are a year away from qualifying for Medicare, falling over the subsidy cliff could cost more than $20,000. Time to bury this thing, stick a fork in it, bury it in the deepest part of the ocean. Focal Point, AFR Talk. Man, it's